from the University of South Florida. I'm a student nurse. I'm here to do your head to toe assessment. Would that be okay?
Yes.
Okay, let me just wash my hands real quick. How have you been feeling?
Fine.
Good? No issues?
None.
Not having any pain this evening?
No.
No? What about any allergies? Do you have any allergies to food or medication?
No.
No? Okay. Well, can I just read your armband?
Sure.
All right. Just tell me your name
Daniel Collins,
and your date of birth.
June 27th, 1981.
And can you tell me where you are?
I'm at the hospital
Okay. And why are you here?
for an assessment.
Okay, great. All right. Well, I'm just going to start at the top and work my way down. At any point you're uncomfortable, just let me know and I'll stop, okay?
Okay.
All right. I'm going to stop at your head. Start at your head. I'm just going to feel any tenderness?
Nope.
No? All right. No having no headaches?
None.
No? Okay. All right. I don't see any lesions or wounds. Your head is nice and warm. It's intact. It looks good. Okay. No issues with your head?
None.
Okay. We're going to move on down. I'm just going to take a peek in here, just a little light. Great. Great. His ears are warm to touch. They're intact. I don't see any visible signs of discharge or bleeding, and they look good. Any issues with your hearing?
None.
No? Okay. I'm going to look in your eyes.
Okay.
Okay. I'm just checking your pupillary light reflex. Great. I'm going to pull this eyelid down just a little bit. Just take a peek here. Great. Eyes feel okay?
Yes.
No discomfort?
None.
Good. The patient is alert and oriented ×4. His pupillary reaction is equal, round, and reactive, and accommodating to light. The patient sclera are white. His conjunctiva is clear, glossy, and moist. His ears look clean inside. There's no signs of bleeding or discharge. The patient appears healthy. Exteriorly, he is dressed appropriately for the occasion. His hygiene is good. I smell no obvious body odor. And he states that he is having no pain. If he was having pain, I would have him rate it from 0 to 10, 0 being no pain, 10 being the worst pain that he's ever felt. Moving on down, we're going to move on down to your nose. Good. Just going to take a peek inside. Your nose. Good, looks good. Can you open your mouth for me? Can you say ah?
Ah.
Stick out your tongue for me. Good. And I'm just going to pull your lip down. Good. Can you smile for me? Good job. Okay. The patient's nasal passage is clear. There's no signs of bleeding. His oral mucosa is moist. It's pink. It looks well hydrated. Upon sticking out his tongue looks good. It looks well hydrated. It's moist. There's no signs of lesions or wounds. There is his texture of his tongue is a little rough, which is normal. His uvula protrudes midline when sticking it a little upward. The tonsils are not inflamed. I don't see any signs of infection. There's no discharge. His lips are pink. They're well perfused. There's no signs of anemia or poxemia. He smiles. Can you smile for me again? Good. He's got good facial symmetry. There's no signs of drooping, which could indicate a stroke. Let's see. What else can we cover, Mr. Collins? I think that's about it. So we're going to move down to your carotid arteries. I'm just going to palpate here. 2 fingers. Great. Great. I'm just going to take a quick listen. When I put the belt to your neck, just take a deep breath for me and hold it. Good. Release. Okay. Deep breath and hold. Okay. His carotid arteries are 2+ bilaterally. They're equal. I can't see any signs of pulsation. I hear no breeze upon auscultation or whooshing sounds that would indicate irregularities. Okay, I'm going to move down to the lungs. Mr. Collins, if you could just sit up, please. Great. I'm going to inspect the lungs. I'm going to inspect the thorax. Note any shortness of breath, any use of accessory muscles. He appears to be breathing normal. Any coughing lately?
No.
No fever?
No.
Nothing that would indicate that you would get into trouble as far as your lungs go?
No, ma'am.
No? Do you smoke?
No.
Okay, great. I'm just going to listen. Take a deep breath. Actually, sir, if you could just, Mr. Collins, if you could just turn around so we can, great. Okay. Take a deep breath in. And just, good job again. Good. Great. Breathe again. Good. I'm just working my way down. Breathe. Great. Fantastic. You're doing great. Breathe. Breathe. Patient's lungs are clear. There's no adventitious sounds, no crackles. Before I left, I would teach him about the incentive spirometer. I would show him how to use it, and then leave it at the bedside for him to use. Encourage him to use that to help expand his lungs. Okay, we're going to move down to the abdominal cavity. Actually, sorry, not abdominal cavity, the heart. This is the cardiothoracic assessment. I'm just palpating for any thrills, heaves, or lifts. The lift, I could actually feel the pulsations, and I don't feel any pulsations or vibrations. Now I'm just going to listen to his lung sounds. I'm going to start at the aortic part. This is on the right side at the second intercostal space. This is where the S2 sounds are heard the loudest. This is moving over to the pulmonic. This is the left side, second intercostal space, where the S2 sounds are heard the loudest. Moving down to the verbs, this is the third intercostal space. This is where S2 sounds are also heard the loudest. Moving down to the tricuspid, this is the fourth intercostal space where S1 sounds are heard. And this is the fifth intercostal space, mitral valve, mid-clavicular line. This is the point of maximal impulse, can be palpated as well. You can palpate for 60 seconds and calculate the rate and the rhythm. His rate is strong and even. I hear no regularities. I'm going to flip the bell over and go back through. Mitral. Tricuspid. Verbs. Great. Pulmonic. Aortic. Great. Any chest pain, Mr. Collins?
No.
No? Okay. Patient assessment of his lungs seem to be, or of his heart, seems to be normal. The patient denies chest pain. His rate and rhythm is normal, it's even, it's strong. I see no pulsations upon inspection. Okay, so now if you could lay flat for me, Mr. Collins. If you could maybe shift your body just a little bit this way for me. I'm sorry, thank you. You're doing great. Okay, now we're going to do the abdominal assessment. At this point, great. I'm going to visualize the patient's abdomen. He's flat. He's non-distended. I don't see any hernias. His umbilicus is midline, which is normal. Mr. Collins, now I'm just going to listen for your your belly sounds, okay?
Sure.
And anytime you're uncomfortable, you just let me know, okay?
Okay.
Okay. I'm going to start in the lower left quadrant, left upper quadrant, right upper quadrant, right lower quadrant. I'm listening for high-pitched gurgling sounds, which he has. If he didn't have high-pitched gurgling sounds, I would listen for 5 minutes in each quadrant. Now I'm auscultating for the abdominal aorta, and I hear no bruits there. Great. Okay. You can sit up, Mr. Collins. Okay, great. Now I'm going to test your strength. Actually, I'm sorry, Mr. Collins, I have one more question. How has your diet been?
Fine.
It's been fine? And your bowel movements? Been
Normal.
regular?
Yes.
Okay. Any issues with your bowel movements? Any diarrhea, constipation?
No.
And with eating and other activity, no nausea or vomiting?
No.
Okay, great. And your bladder, I noticed it was not distended on exam, which is good. How is your voiding patterns, your peeing pattern?
Normal.
Normal? Okay, good. Frequency is good?
Frequency is good.
Okay. Are any issues with such as pain upon voiding, retention, and no issues noted?
No.
Nothing? Okay, great. All right. So at this point, I would discuss intake and output, and making sure that he was drinking good and noting his INOs. Okay. Moving on down, we're going to do skin. The skin is warm and dry to touch. There is no. His pigmentation is smooth. It's regular. There are no lesions or wounds. To note, if I did, I would note the size of the wound, that if there was drainage or such, I would note those things. Good. So his brachial arteries are equal and bilateral. I would rate them a 2+, and his radial pulses are also equal. They're 2+. They're not bounding. They're not diminished. They're nice and strong. He's warm and dry. I'm just going to look at your nails. Okay, good. He's got good skin turgor. He looks very well hydrated. His pigmentation is great. There's no pallor. There's no clubbing, and his capillary refill is less than 1. So that means you're oxygenating well. Moving on down to the legs. Oh, actually, Mr. Collins, one more thing. Could you just squeeze my hands? Good. Can you push down? Good. Lift your hands straight up for me. All the way up over your head. Great. Push down on me. Good. Any numbness or tingling?
No.
In your arms? No? Okay, great. And your legs? How do your legs feel?
Fine.
No numbness or tingling?
No.
Numbness or tingling here?
No.
No? Okay. I'm just going to feel on the back of your... Can you slide? Sorry, just slide up for me. Great. Great. Popliteal arteries are +2. Moving on down to the tibials. Tibial arteries are +2. Dorsalis pedis are 2+. His skin is warm, dry, and intact. There's no sign of lesions. There's no signs of scarring. His skin looks good. Any issues with your mobility?
No.
No issues with falling or tingling?
No, ma'am.
No? Okay. His toenails are clean. They're not brittle. They look great. His capillary refill is also less than 2. There's no issues there. Okay. Well, everything looked fantastic, Mr. Collins. Are you ready to go back to bed?
Yes, ma'am.
Okay.
Thank you.
Let me get you a pillow. Okay, slide back up here for me. All right. I'm going to leave you the call light. Is there anything else I can get you?
That'll be it.
Okay. I'll just hit the nurse's button. It's this little red button if you need me. Okay?
Okay.
I don't go anywhere. Your water pitcher is here. I'm here till 7. I'm going to put these side rails up. Okay? Your incentive spirometer is at the bedside.